Hello, my name is John Weingart, and I'm director of the Johns Hopkins Comprehensive Brain Tumor Center. I'm a neurosurgeon here at Johns Hopkins and primarily take care of people who have brain tumor problems. We have a very large brain tumor center here at Johns Hopkins that involves neuro-oncologists, radiation oncologists, neurosurgeons, medical oncologists. We take care of many people with these kind of problems every year. In fact, we probably do over 1,000 surgeries a year for this problem and take care of many more new patients who don't need surgery. This is a challenging time for a patient and their family if this happens. And we know that it's difficult sometimes to get access to resources and services that you might want. And it's hard to navigate the process sometimes in terms of getting an appointment. So this video here is to help facilitate you getting access to Johns Hopkins, getting access to our Brain Tumor Center, which supports people in all of the aspects of this problem, from an operation to care after surgery and to getting back to their normal life. So I hope you find this video helpful, and we will go over each of the different scenarios as to how you might need to get an appointment here with us. I'm going to cover several different scenarios. The first is that you've been admitted to a hospital or you're in an emergency room and you would like to be cared for at Johns Hopkins. That can be a hospital or an emergency room here in Maryland or outside of Maryland. The second scenario is that you live in Maryland or in a neighboring state or Washington, D.C., and you want an appointment here at Hopkins. You're at home and you've been told that you have a tumor and that you need to see a neurosurgeon. The next scenario is that you live far away from Maryland, in a state beyond the bordering states of Maryland, and would like an appointment. The next scenario is that you live outside the United States. And then the final scenario is that you have a more emergent situation. Your doctor has told you that you need to see a neurosurgeon right away. They may even have said, go right to the hospital. This is a separate scenario that we have an expedited evaluation process. Going back to the first scenario where you're admitted to a hospital or you're in an emergency room, you can ask your doctor to call Johns Hopkins through what we call the Hopkins Access Line, and the number is 410-955-9444. Your doctor will be connected through an operator to one of us. We will talk to your doctor about what your situation is. We may even have access to look at your imaging studies, and we can arrange transfer directly to the hospital. The next scenario is that you live in Maryland or one of the neighboring states or in Washington, D.C. And again, you've been told that you have a brain tumor, that you need to see a neurosurgeon, and you want to have access to Johns Hopkins and to be seen in neurosurgery. This applies for adults or children, and the numbers to get access or to get an appointment here are the following. For an adult, it's 410-955-6406. And for pediatrics, it's 410-955-7337. Now, when you call, you will talk to an operator, and they will ask you to send certain pieces of information. That information will include your MRI report, the diagnosis that you've been given, and some contact information, including your insurance information. You'll be given a fax number to fax the information to, and that is 410-630-7865. Now, what happens at that point is that that information is reviewed, and you will get a call back as to an appointment. Depending on the urgency of that evaluation, that appointment could be within a few days, it could be within a week, it could be at your convenience, depending on where you live. If you live outside of Maryland or the bordering states and have to travel a long distance to get to Hopkins, we have a service that can facilitate and help you with that. It's a medical concierge service. We call it Hopkins USA, and the number for that is 1-855-695-4872. Again, the medical concierge will ask you for certain pieces of information. This will include whatever records you have from your doctors, from your MRI scan, and get some insurance information also. That information will be then passed on to us in the neurosurgery department where we will review the information, and then you will get a call back to coordinate a time for you to visit. That time will be coordinated to meet your schedule as well as ours. If you live outside of the United States, then there is a service to facilitate a visit here at Johns Hopkins. And that's called the Johns Hopkins International Office. Their number is 1-410-502-7683. The operator or the concierge that answers the phone will obtain the information about your problem, will ask you to fax certain pieces of information, and then based on the review of that information, you will be contacted about arranging for a visit here at Hopkins. The next scenario is an urgent one. This is where you've had symptoms that have led to the MRI scan or to the CT scan. Your quality of life or your daily function is being affected in some way. Your doctor tells you that you have an urgent problem that you need to be seen right away. Your doctor may even have told you that you need to go right to the hospital. In this situation, we have an expedited process. When you call the Hopkins neurosurgery referral line, you tell the person that answers the phone that you have an urgent problem. They will ask you for your diagnosis or what your doctor has told you is your diagnosis. They will ask you to fax the MRI scan report or have you read the conclusion on the MRI scan report to them. They will take that information and pass it directly to one of us on the brain tumor team, and one of us or our assistant will get back in touch with you within 48 hours to arrange an immediate visit. In conclusion, we have a tremendous team here at Johns Hopkins. We have a large group of people that are interested in taking care of people that have brain tumors and brain problems. We don't want any barriers for you to have access to us. So this video is to help facilitate and expedite the process for you, and I hope that you found it to be helpful.